Chapter 5, Evidence-Based Practice. Evidence-based practice is a problem-solving way to some clinical problem. This uses the scientific method and the nursing process with the expertise of the nurse, the patient's preferences, values, and any healthcare resources to make decisions about our patient care. Research has shown that evidence-based practice enhances patient care, decreases costs. It helps empower us because we're able to assist our patient to their level of health and wellness, and it improves patients' outcome. As a nurse, we face clinical decisions when we're making patient care all the time. Okay? We look at this in a reliable way that is a feature related to the quality of care and the time of care. This slide evidences the need for the care that we provide. So for us as nurses, our biggest challenge is to be able to obtain the most accurate and current information when we're giving patient care. So our best actual scientific evidence comes from research studies that we find in peer-reviewed journals. So even when we use the best evidence, we need to make sure that we apply the evidence and that the outcomes differ on our patients' values, their state of health, their own cultural preferences, their own expectations. It actually, for us to use evidence-based practice correctly, it involves both being ethical and accountable to the nursing profession. So these are the listed steps of evidence-based practice. For us, evidence-based practice is always a systematic problem-solving process. It helps to bring about the achievement of best practices for nurses. We constantly follow this step-by-step approach to ensure that we are able to gain the greatest available evidence for our patients' care. As a nurse, we know that learning for us never ends. So we always have to be questioning, okay? Because changes in healthcare, they're often made really slow because there's some barriers that will actually not allow us to use evidence-based practice. When we don't provide evidence-based care as nurses, patients can oftentimes have very poor outcomes. When we perform nursing research, we ask a clinical question, okay? And we use what's called the PICOT format. This questioning format, it allows a nurse to identify keywords whenever they're looking and doing a literature search. All right. This format also allows the nurse to ask questions that are intervention based. So you look at, when we're talking about a PICOT question, we always have a certain patient population. There's always some intervention that we compare, and then we're looking at an outcome, and we're looking at a time. So for my research, my question was, does the use of an educational intervention impact associate degree nursing students' perceptions of an electronic textbook? And when you looked at my intervention, it was giving the students an educational video to watch as well as a handout. And what I did was look at their before and after, and that was my comparison. Of course, as a nurse, you always want there to be a positive outcome, right? So I was hopeful that the outcome would be something that would be knowledge-based. And the time frame for me was an 8-week term period. So when we're looking for the best evidence, right, we're looking for journal articles, peer-reviewed journal articles that are within the last 5 years. So if you were doing research currently, you would want to go back 5 years from today's date. Okay? When we're using peer-reviewed articles, these are reviewed for their accuracy, their validity, their rigor, and we want to make sure that it was approved for publication by experts before it was actually published. Okay, so for nurses, we often will use Medline or maybe the Cumulative Index of Nursing and Allied Health Literature, which you know is CINAHL. These are some of the best known online databases for scientific knowledge in healthcare. So when we're looking at best practice and finding the best evidence for our research, when you look at this figure, you will note levels of evidence, and you will note that it is a hierarchy of evidence. So the level of rigor or the amount of confidence that a nurse has in the findings for the study decreases as we go down that pyramid. So we always, when we're looking at our articles that we have found, we want to make sure that they are level 1 articles. So when we're doing research, we will critically review and analyze evidence that requires a systematic approach, and we will evaluate that evidence. When we do that, we want to determine the value of the evidence. Is it feasible for our actual study? Is it useful to help make a practice change in nursing? Okay, so when we're looking at it, there's some questions that we ask. When we're trying to determine whether or not it's worthy, we're looking at the level of evidence, how well was the study conducted, how useful are the findings to nursing practice, and after you have looked at all of the articles for the PICO question, then you're going to actually combine the findings so that you can determine the evidence that is out there currently. So whenever you're doing a research paper or research article, this part of the paper would be called a literature review. So when you are doing this, if you decide that the evidence that you have found in your literature review is very strong and applies to your patient population and the clinical situation, as a nurse, you would begin to identify how to incorporate it into the practice. Okay, so the first thing we're going to do is apply the research into our plan of care for our patient. When we evaluate an evidence-based practice change, we want to determine whether or not that change was effective. Did the modifications do we need to have modifications in the change? Or does the change should it be discontinued? All right, we have to look at potential events or even results that we didn't expect to happen. So to enhance professional development and promote good patient outcomes beyond the unit level, then we would share the results with groups of nurses, such as the Nursing Practice Council, maybe the Research Council, And we know that as a professional nurse, it is critical that we actually contribute to our own nursing profession and help grow the knowledge for our profession. In order for us to be able to use this knowledge that we have acquired all the time, it's going to take great leadership. Okay, transformational leadership. These people believe in what they're doing. They're very transparent, so you can understand them. They look at leadership not as an autocratic leadership. They have committees. They listen to their people. They take surveys. So we have to have a specific leadership for this research that we're using can be sustained throughout our clinical practice. When we're doing nursing research, we are looking at ways to help improve both the health and the welfare of all individuals within the United States border that are underserved. Okay, that doesn't mean no insurance. It means they can have insurance but still not get that great quality care, so they're not getting equitable care that everyone else gets. So when you're reading this case study, here's a question that you want to think about. What would be some advantages and disadvantages of belonging to this practice committee? Consider how the incidence of infections come to the nurse's attention. How do they notice? What are they looking for? So what about what are some potential causes of this type of illness for these patients? Translational research focuses on testing the interventions to improve the reoccurrence and the use of evidence so that we as nurses can improve our patients' outcomes and overall general population's health. This for us is called implementation science. So the purpose of studies in translational research, this is to test implementation science strategies to determine the strategies that will work best so we can promote the further use of evidence-based practice. In today's healthcare delivery system, it is more important than it's ever been to understand the results of healthcare practices. Outcomes research. This helps every individual, whether it's the patient, the provider, those that make policies, so they can make informed decisions based on evidence of the here and now. It's not based on what happened 20 years ago. Outcomes for us, it usually looks at benefits, who benefits, how they benefit, what are the risks that are being taken by using this intervention, what's it going to cost, and does it have a holistic effect on the treatment of our patients. So the scientific method, it is actually the foundation of research because it is the most reliable and objective method of gaining knowledge. So because this is an objective way to gain and test knowledge, the method actually guides us in applying research-based evidence into practice and conducting future research. When we use research-based findings to change our practice, we have to make sure we understand the process that is used to guide the study. The scientific method is a very systematic step-by-step process. When we apply it correctly, we know that our research study will support the validity or how valid is the data. the reliability, or could we reproduce the study again, and the generalizability, or can we actually apply this to a greater research population of individuals out in society? So here's a question for you. Which of the following is the first step of the research process? The answer is B, identify a problem. We know that identifying a problem is the very first step for us to perform any research. So there are multiple different types of research. When we look at quantitative research, it is research that deals in numbers. So you do some data, you use statistics and probability, and you actually get information back as scientific numbers. And then you are able to explain how you reach this. There's a very step-by-step process with quantitative. Qualitative research, this is when the researcher could actually become part of the research study. Qualitative is about feelings, thoughts, and ideas. So there's no basic numbers to figure out. There's no tests being given. But it's a way to look at individuals through a very personal level. So the research process is a very orderly series of steps that allow the nurse researcher to go from asking the PICOT research question to finding the actual answer to the question. Usually the answer for the very first initial research question can lead to new questions, as well as other places that we need as nurses to perform studies. The research process always builds knowledge for us to use in similar situations. So this slide helps you understand the research process on the right and comparing it to the nursing process, which is ADPI. So what clinical question would you as a nurse develop to address this problem? And then what goals or outcomes would you use to measure the steps of changes that is actually suggested by the research study? Performance improvement, this is an actual formal approach. It looks at the analysis of healthcare related processes. It will also involve the review of how interventions within the process function. Healthcare organizations will routinely promote efforts for improving patient care and their goals, particularly when we're thinking about reducing medical errors and increasing our patients' safety. So process or performance improvement is continuous and an ongoing effort to be able to measure the improvements in the efficacy, effectiveness, the performance, outcomes, the accountability, and other indicators that we measure the quality of medical services or processes by. So all three of these, evidence-based practice, research, and performance improvement, they all are related, but they're all separate. They're all their very own process. So evidence-based practice, obviously we're getting that from research. When you're looking at research, it is a way that we ask questions to solve problems. When you're looking at quality improvement, it actually improves the way we work at improving patient outcomes. all right, because we want everything for our patients to be the best. So each of these works together, but they're each their own entity. So because each of these are separate, but they work together, this slide shows you how the three of them will actually overlap, and it works for evidence-based practice. Okay, so you can see how they work together. So every healthcare organization gathers data on health outcomes. An example of this is key quality of care or performance indicators. And which of these might be included? So the answer for this is infection rates, D. Sometimes as nurses, we use data that is gathered from a healthcare setting to look at clinical trends whenever we're developing our own questions. If you think about it, many hospitals keep monthly records on quality of care or performance indicators, looking at whether it's infection rates or medication errors.